have had a huge spike in numbers over the last 2 weeks. And I want to talk about that a little bit and talk about some of those cases and the sources of their infection. We've had a 23 case increase over the last 2 weeks, since 2 weeks ago today. 17 of those cases just occurred since last Wednesday when we were on here doing our media update. So that is a very large number, one of the largest numbers that we've seen in an increase in a week. So let's talk a little bit about the exposure from these cases. We do know that out of those 23 cases, that 10 of them, we don't know their exposure. So that has contributed to what we call community spread. They've picked it up somewhere in their travels about the community. 4 of those 23 cases were exposed in their workplace because of other cases that were known about where they work. 4 of those 23 also were related to travel. They had traveled outside the county to, I think most of the 4 had traveled outside the state to areas where there were an increased number of cases and they were having an outbreak, particular outbreak in that particular area. 5 of the 23 cases were a contact to a family member who had tested positive, and then 2 of those 23 cases were what we think were healthcare exposures. Someone had a surgery in Nashville at a hospital and came back symptomatic. And then another one travels only from their house to receive medical services. So we felt like those 2 were healthcare exposures because they weren't exposed to anybody else. So this is concerning for us with the 23 cases, and especially when you look at 17 cases increased in a week's time, in a 7-day period. That is concerning for us. We know we're going to see increased cases as we go about our business in the community. And we don't want to discourage people going out and spending money and shopping retail and eating at restaurants. But at the same time, we really want to encourage people that this pandemic is not over, and we need to be as safe as we can when we're out conducting business, whether that be business we're conducting or for recreational reasons. Please be safe and use a facial covering when you cannot social distance, and just be very leery about attending things that have a large group of people that you are not usually around, or that there may be strangers there that you are not normally in contact with. Because at this point, we really need to treat people like we don't know what their status is. They could be positive and us not know it. So when you're out and about, if you will use a facial covering to keep people from your germs, and hopefully the other person will do that for you. I want to talk a little bit about our nursing home.